I'm Antoni Chan. I'm consultant rheumatologist from the United Kingdom, reporting for Room Now here in EULAR 2022 in Copenhagen. There has been a lot of interest in the field of telemedicine here at EULAR 2022. We've had discussions, plenaries, and also debates on whether telemedicine is here to stay or whether this is something that was just being done during the COVID-19 pandemic, and what will be the long-term outcome and use of telemedicine in our clinical practice. But I wanted to highlight some important abstracts that focuses more on patient engagement. What are the patient factors that allow patients to engage in telemedicine or e-health in terms of data collection, in terms of participation, in terms of completing outcome measures? Because this is important, we have to have both clinicians and patients both agreeing that this is the way forward in order for telemedicine or e-health initiatives, digital health initiatives to be effective. The first study that I wanted to highlight is the oral presentation OP301, which was a systematic literature review looking at e-health. So they looked at remote monitoring, e-diaries, and a whole host of other digital health initiatives to improve patient care. And what they were trying to study was to see which patient group had the highest participation in terms of e-health initiatives. So it turned out that the osteoarthritis group was the highest, somewhere about 80%, followed by gout patients, then rheumatoid arthritis, and then spondyloarthritis. So is this a disease-specific phenotype that these patients may therefore engage in e-health technologies? On further analysis, it appeared that when these studies were carried out, the longer the study duration, the lower the participation. It might be that if studies are drawn out for a long time, there might be a drop-off in the participation. So the osteoarthritis studies tended to be shorter than the rheumatoid arthritis study, and the authors conclude that this might be an important factor as to why the osteoarthritis engagement was higher than the rheumatoid arthritis ones. They also looked at other factors such as age, and again, these were also considerations in terms of how the patients engage with the e-health technologies. The next was a poster, POS0381 by Sapin and colleagues, and this is an interesting study, and this time they looked at rheumatoid arthritis. They looked at the collection of electronic patient record outcome measures, or EPROMs, and they used the rapid tree and also the PASS outcome measure. In addition to sending out electronic patient-reported outcome measures, they also contacted the patient to ask them whether they had a flare-up in between clinic visits. And what they found was when patients completed their rapid tree score or the PASS and the scores were low, and they did not report any flare-ups during the interval in between clinic appointments, this correlated very well with the ability to manage these patients without the need to escalate either steroids or disease-modifying drugs at the subsequent clinic visit. This led them to conclude that if there is enough evidence that these measures work, such as a low patient-reported outcome score, like the rapid tree or the PASS score, and the absence of any flare, they may be given the opportunity to skip one clinic appointment, as this would save them appointment since there was no indication to escalate their treatment at the subsequent visit. So I think this is important. This is a novel way, and certainly we are also doing similar work to try to manage our capacity better by using electronic patient-reported outcomes. The next study was from the home team. So this was from the Danish group. This is poster 0373 from the group in Copenhagen, where they used the Dan Bioregistry. Glinbock and colleagues reported this one, where they use patient-reported outcome measures, and they asked patients to complete these scores online. And what they found is that there was a variation in terms of participation or engagement. The highest group that participated were those between the ages of 40 to 80, those who were on biologic treatments, and those who had a lower HEC score or function. They had improved clinical function. They did not find any differences in terms of the diagnosis or the disease duration. What they did find is that in the younger age group, certainly those below the age of 40, if you send them clinical reminders, then the engagement increased significantly. So using techniques such as text messaging, reminders, electronic reminders can improve the outcome in the younger group. In the older group above the age of 80, they felt that these were possibly due to technical skills or technical challenges, and also whether they had the facilities to engage using the electronic form. So I think there's a lot of work here at EULAR 2022 in the whole topic of telemedicine, but I would just wanted to focus on the other aspect about patient engagement and trying to ensure that we also understand what's it looking like from the patients and how we can leverage to try to increase engagement with our patients with using such digital health technologies. So I'm Antoni Chan, reporting from EULAR 2022. I hope you enjoyed the abstracts. Thank you.